Hi, welcome to Maker's Bar. I'm Akshita. Today I have Chaitanya Razdan, founder and CEO of Care+Wear with me. Care+Wear is an innovative healthwear brand that has reached millions of patients. The company is on a mission to bridge fashion and function for more human healthcare experience. What started as a personal mission to help a friend going through chemotherapy has become a massive healthcare platform. Chaitanya has an undergrad from University of Virginia and an MBA from University of Chicago's Booth School of Business. Welcome, Chaitanya.
Thanks so much for having me. I'm excited to share more on the CareWear story today.
Yeah, me too. So, Chaitanya, tell me about the moment when you first had the idea of starting this business and what kind of inspired you to start this company.
Yeah, totally. So it happened a little over 9 years ago now, which is kind of nuts, but it probably explains why I have less hair and whatever's left is turning gray. But had loved ones diagnosed with cancer, getting treatment through their arms through what's called a PICC line. And they had been told to literally just wear a sock on their arms. So saw
Yeah.
people wearing socks and thought, wow, this sucks, there's got to be something better. And so started working with nurses and doctors from Johns Hopkins and UVA to try and redesign the sock. And kind of while we were doing that, I took a step back and realized whenever you go to the hospital, everything's always been focused on function and not on how it looks or how it makes you feel. And so really just wanted to build a brand in the healthcare space. And so today, CareWear is really focused on trying to help every single person feel like a human again in and out of the hospital.
Yeah, so my dad was recently hospitalized as well, and
Oh, sorry to hear that.
yeah, he's fine now.
Okay, good.
He was in ICU. So when I
Oh,
was like
wow.
struggling with it, yeah,
Hmm.
I totally understood like what the mission of the company was. So tell me, like I know you started with a particular product line, but what are the different product lines that your company has now, and how, what exactly, like what is like your main product line that like sells the most? I would say.
Yeah, totally. So we've evolved, as you said, we've evolved quite a bit. So started with pick covers, and then we had moved on to also create um, our chest access shirts. So those are shirts that open up and provide access to your chest for ports and for ports and central lines and things like that. We've even heard stories of people using them for maternity reasons, for breastfeeding. And then we started expanding products more. So today we have a huge chest port collection. So no longer just one pair of shirts that open up and get access to the port, but a collaboration with Oscar de la Renta to have hoodies, a lot of blouses and shirts that get you that access, and even ones with fake snaps, just trying to look a little cute, or sorry, fake buttons to look cuter, etc. We have patient gowns that we designed as part of a class we taught at Parsons School of Design here in New York. Um, we have arm access shirts that we did as part of a collaboration with the Natori company, post reconstructive surgery bras, NICU onesies. And then during the pandemic, we actually launched a clinical line in collaboration with the Natori company. Basically, feedback we had heard from all the nurses and doctors was, we wish someone was taking care of us. We're out here on the front lines and no one's created something that's comfortable for us to be able to wear and look good and feel good while working our 12 to 18-hour shifts. And so we were really proud to do that. And now we even have been able to create uniforms for some of the staff in hospitals too. Um, in terms of kind of sales and company, I'd say we kind of split the company up in our patient line and our clinician and hospital employee line. Ultimately, we see it being around a 50-50 split, with the goal of helping, again, each and every person that goes in and out of the hospital.
Yeah. So when you first started, obviously,
Mhm.
it must have been very challenging to to say that you need something good to wear in the hospital.
Yeah.
What do you like your challenges? Like, how, I mean, and how did you kind of overcome them? Like, trying to sell something like this when somebody is like trying to figure their life around.
Yeah.
Is Yeah. So how do you do that?
Yeah, very slowly, I guess, at the beginning. But I think kind of we take two angles. So we look both in terms of going to market, we sell both B2B and D2C. So on the B2B side, we're partnering with different hospitals and partners to be able to provide our products to their patients and their clinicians and their staff. And that's something that's super important for us, a big driver for the business. And then it's also D2C, helping every single person with what they wear in and out of the hospital. We sell on our own website, careandwear.com, as well as Amazon. We're in about 1,000 CVS locations in the US, and then partner with a lot of other amazing partners as well. And I think for us, it's at the end of the day, we want to help every person, right? And so when we think about how can you do that, it's being able to reach you through every moment. So for hospitals, we'll be able to provide them products that they can provide. We found a lot of people when they get the product from the hospital will then actually come to our website and buy more products. And so offering a huge variety has always been important. So having different colors, different designs, and trying to make it fun. We have, for all those baseball fans out there, we have all the rights to Major League Baseball. So you can you can show your Baltimore Orioles support even while you're getting your infusions.
That is good.
Yeah.
So I'm sure you didn't from what I've gathered, you've not had a healthcare background, and you're trying to get into move to a space where you know very little about business partners or partnerships that you want to get in, as you said, B2B.
Mm-hmm.
How did you convince and it was something that you created for your family or your loved ones, right?
Yep.
You go from there to having your first investor to building such a big business.
Yeah, totally. I'd say it's probably sometimes it's actually beneficial when you don't know because you don't know any better, right?
Yeah.
So when I started the company, I was like, you know what? I'm just going to call, just like when I came from a consulting and an investment banking background. And for
Yeah.
both roles, I had just always looked at, okay, what are the top ranked firms and let's apply there and get a job. I kind of looked at it the same way in terms of selling. And so, like, two of our first two customers, for example, were the Mayo Clinic and the Cleveland Clinic. And when you think about them from a brand recognition standpoint, they're huge. And I think
Yeah.
it's because I didn't know any better. So I just reached out to them directly. I think it was a lot of cold calling. When I came up with the idea, I probably talked to about 1,000 different people at different hospitals and institutions. And so that kind of taught me that there's never anything wrong with cold calling and trying to call as many people as possible. And so we've done that from day one. I actually still to this day spend time with our team each and every day cold calling hospitals. I think it's super important. It's a way to kind of drive the brand awareness, et cetera. I think the second thing in terms of building the product, to your point, I don't come from this background. My mother's an anesthesiologist, so I spent a lot of time in the hospital chasing her around, kind of probably being a disaster for all the nurses that worked with her. And also spent a lot of time as a patient. I had tubes in my ears 3 times as a child, so was getting operated on a number of times. I had a lot of broken bones, and so got to know my orthopedic surgeon really well, and so spent a lot of time as a patient too. And so even though I didn't necessarily come from selling into healthcare, it was something that I'd grown up around and been around.
Mhm.
And I think that gave me a huge appreciation for what everyone does. And then it's just pounding the pavement. I think it's talking to people, seeing how you can iterate a product, how you can improve. We like to say for us, there's never a final version. Google for years had Gmail having beta in the logo. And if they could have hundreds of millions of people using their platform with in a beta, like as showing beta there, then we can do the same in our world where we can always be looking to improve. In terms of getting to the investment piece at the beginning, it's always finding people that have worked with you and that know you. I think it's really hard to be able to raise money from strangers without going to people that know you. And I think it's a lot of people will say, well, I don't come from a really rich background. I don't have a lot of rich people. And I mean, the smallest check I took was a $1,500 check. I think that's something that people can write you regardless of the size. And I think that was really important, is finding people that were really passionate about what we were building, that believed in us. I remember one of my friends, when he invested in us, said, I would give you money to build a lemonade stand. And I was like, well, it'd be a great lemonade stand. And he's like, yeah, that's why I would invest in you to build it. And I
Yeah.
think it's finding people that want to bet on you to help you kind of build something great, and then not being afraid to utilize them and use their connections, etc.
Yeah. I think that friend who said, I'll give you money to build a lemonade stand, probably he's worth keeping for the rest of your life.
Yeah, totally, for sure.
So how did you? So obviously you've had like a long journey, and getting Mayo Clinic as your first. First of all, I don't even know how to go about pounding payments of Mayo Clinic, because it's extremely hard to do, and that's a big organization, and it's very hard
Mm-hmm.
to get big organizations. So obviously you must have had adversity and doubt when you uh, you know embarked upon this journey. So how did you kind of handle that?
Yeah, I mean, I think you have adversity and doubt literally every day of your life. That's secret number one of being a founder and entrepreneur. It's kind of what drives you.
Yeah.
I think it's using that adversity and doubt to come into something better and something bigger. And I think a great example is when we started, we had these black pick line covers, and we used to get them washed twice by the factory, and then they would make them and send them to the customer, and we would always test them ourselves, because it's really important to wash test, to wear test, etc.
Mhm.
I actually ran a marathon wearing our pick line cover, and I'm not a fast runner, so we got to really truly test that pick line cover out in stringent experience. But one thing we didn't test is receiving it from a hospital setting, and so we got the pick line covers to a hospital customer direct from the factory. They put it on, and the black of the pick line cover started pilling on the bandage that you wear. And we had worn the bandage, we had tested it out, but we had always washed the cover before we put it on, because that's what you do with clothing, right? And in a hospital, for a product like this, they weren't doing that, because they're not going to send something out to get laundered before they put it on if they don't have to. That's a massive extra expense. And so the black starts pilling off, and thankfully we had told the nurses that we were working with, like, hey, we're a startup, we're like, they knew our story and they wanted to be a part of it. And so when the black came pilling off, they weren't, hey, we're never going to work with you again. It was, how do we solve for this? How do we figure out what the problem is?
Yeah.
And so we were able to make them kind of not just customers, but really feel like they were part of the team and a part of the problem solving atmosphere. And so they worked with us in our factory to try and solve the problem. And at one point, I forget who it was, but someone was just like, well, are they washing it before they wear it? And they're like, no, obviously not. We're taking it out of the packaging and putting it on. And that's when we realized, well, why don't we test, if you wash it, if you put it on, does that still have the same issue? And it did not. And so then we started washing the product, not just before, once the fabric was made, but also after the actual product was made, before it was put in packaging. And the solution was literally washing it twice. And then the pilling stopped. And so I think a big lesson there is you can actually use that as a way to create stronger relationships, right? Like, we were facing the potential end of the company before it started, really. And instead we used it as an opportunity to make a better product together. And it kind of showed in real time our desire to always be improving our products at all times.
Yeah. So I think this is a great story for my next question. Like,
Mhm.
obviously it's in the healthcare space. You need to have a certain quality standards and things of that nature, right? So you need to have some key values for your company and what you represent, right? How do you ensure that that's like kind of upheld, and you're maintaining quality, or whatever that metrics are across all your product lines and your organization?
Yeah, totally. So we have a few pillars for the company that we make sure that we follow at all times. From a quality control standpoint, we work with some of the biggest quality control companies out there, companies like Intertech and SGS, which do millions of checks for all the fashion companies out in the world. And I think that what's important is just the level of detail that we do for quality control and when we're doing quality control. So we have a lot of factories, we work with a lot of factories, and we do both standard checks as well as surprise checks where we're going in and just seeing how things are being handled, what the quality is like, et cetera. We have pretty stringent guidelines with our factories and requirements that they have to hit. And then we kind of make sure that in every factory we're working with is coming to us from a strong reference. So we generally aren't working with random factories that no one's heard of, but rather we're working with big time factories that our goal is to always be the smallest customer of the factory, because that means that they're really big time and they have a lot going on.
Yeah.
And so for us, it's how do you create partnerships with the factories where you work with them day in and day out, and you're able to build upon those relationships. And that's been really, really important. So much so that, I mean, at one point, we created a product where the factory actually had suggestions on what they would improve and what they would change. And I think that's pretty special when your factory is giving you feedback on the product. Either that or they saw me and they were like, wow, he really needs our help. But regardless, it was being able to partner together and always be trying to do what's best for the end user and the end customer. And that's kind of what drives us each and every day is we have care in the name of our company, right? So we obviously want to care about each and every step of the process and each and every person that we are working with.
So obviously it's a fashion brand in some form, right? And you did come from a very investment banking, consulting background, right? So how do you foster creativity? Because there's some amount of creativity that's required here as well. How do you do that?
Yeah, it's a great question. I think one, it's you hire creative people. You hire great people that want to work together and collaborate and think outside the box. I think being at a startup, you're never gonna, for example, have a role where you're only doing one thing. I think in the early days, we actually did quality control in our office on every single piece, and we would have quality control parties where we'd have pizza and the whole team would sit there and go through every single product. It's developing that kind of maniacal love of the product, I guess. We have every single person on our team does customer service. I think it's really important that everyone is talking to our end users frequently. And, you know, it's not every day, 24 hours a day for most people, but it is something that's still important, and it gives you an understanding of what's out there. And then it's empowering the team to be able to make decisions and do things. I think I always think it's kind of nuts. Like there's fashion companies where the CEO has to approve everything. And my philosophy is obviously I want to know about stuff and I want to be aware of things, but there's a few areas where you probably don't want me being the one to make decisions.
Yeah.
For example, TikTok, I don't even know how to log into TikTok. So the team runs with our TikTok account on their own. And I think that that's really important is having people truly feel like owners and get to bring out their best creative sides. And I think that helps a lot.
Yeah. So tell me, what would you like, since we have spoken about this, what would you like describe your leadership style as? Like somebody who likes to just, I mean, what would you say like your leadership style would be?
Yeah, it's the probably constantly improving because this is my
Yeah.
first time running a company. Now, I think it's fun but serious and like really strong attention to detail and really trying to do what's best for, again, for the end user, for our team. I think like, again, we have care in the name of our company. So it's something that we take very seriously and think is very important. And I think for better or worse, where people like I have a photographic memory, so it's kind of unfair for people, but I'll remember things that we talked about forever ago without ever taking notes or anything like that. And
Uh-huh.
so it's bringing that level of accountability and everyone, and that's super important. And then I think it's just remembering to, like, I try and have an open door policy whenever possible. Right now my door's closed so no one accidentally walks in here, but I think it's really important that everyone you lead by example, right? And I think that that's kind of why I still cold call. That's why I try and help in every area that I can. Is the best leaders, at least to me, have always been the ones that I felt had been in my shoes and kind of gone after what I was trying to go after. And so I try and do the same thing.
Yeah. So I'm jealous of the fact that you have a photographic memory because that's something that I don't.
It's
I
great.
have to constantly depend on
Gotten
my.
really spoiled.
I'm always jealous of people who have a photographic memory because I have to depend on my notebooks all the time. How now that you've led this business for so long, how has your business evolved since you first started, and what's your vision for the company?
Yeah, totally. So, I mean, when we started, we were trying to help a patient population that was around 6 million people and growing at around 5%. Now, our products span probably 8 plus billion people a year and growing at the world population. So, we've definitely evolved in terms of product market and what products we have out on the market. I think we've also evolved how we launch a product. When we started, we launched one color, one product. When we launched our clinical line, we launched scrubs, both tops and bottoms, different types of tops and bottoms, bouffants, fleeces, under scrubs. Like, we launched a whole collection. And I think that that's something that has evolved over time, where when we're launching, we're trying to help create products that are really focused on helping as many people as possible. I think the second thing that's evolved is our ability to kind of have customers from day one. When I started the company, we did not have anyone to buy the product from a B2B side. Today, when we launch a product, we generally have a customer lined up that's going to buy the product as we launch it. And I think that that's really important. When you think about getting a product out there in the wild, I guess, if you will, you're not spending, the risk is minimized, and you're also able to get feedback in real time and be able to improve the products in real time.
Yeah. So tell me, so now moving on to some other questions, tell me about a book or a mentor that has deeply influenced your entrepreneurial journey. And I think there's another question that I have to. Did you always think that you wanted to become an entrepreneur, or it just was an accident?
Yeah, great question. In terms of books or mentors, I mean, I actually read 30 minutes every night. So I don't want to give credit to only one book, because I think it's really important as a way to keep growing and learning. I can probably, if anyone's interested, I can send you a list of probably like 5 billion books to read that I think are great. In terms of mentors, I've been really blessed to have incredible mentors throughout my life. Both in the consulting and banking careers, I had amazing leaders that I still go to all the time. And I think it's super cool because I'll email them and I'm still like kind of worried, right? Like, are they going to email me? Do they remember me? And they reach back out immediately all the time. And I joke that a couple of my Goldman mentors probably reply to me quicker now that I've left than when I was there. But it's pretty incredible to have amazing people behind you, helping support you. And I think for me, it's not just professional mentors, it's friends that are amazing bases for me and our team. It's my family. Like, we always talk about how you're joining the CareWear family when you join our team, and you're going to get to know my entire family. My sister is an advisor for us and helps us with a lot of our work. My parents are people that I think everyone on our team has met and spoken to, and they're trying to help at all times. Like, for example, as we started growing and looking for more factories, my dad was calling up family friends, talking to different factories, etc. My mom, again, is a retired physician, so a lot of what we're trying to solve for, she has strong opinions on. And I think that that's really important, is being able to surround yourself with amazing people. And I tell everyone my goal is to be the dumbest person in the room, and normally that's the case. So that's been great. And sorry, you asked another question that I haven't answered.
Did you always want to be an entrepreneur?
Yeah. So I knew I always wanted to lead something. Growing up, I'm a very protective older brother. Growing up, I always was the one in charge with my sister and our cousins and friends, and always kind of like when you'd play like, I forget the name of the game even, but it was like robbers and police chiefs, or like
Yeah.
police team,
I've
or
seen that when I was young too.
yeah, I was always the police chief. I was inspired by amazing leaders that had built incredible companies, and I wanted to do the same. Did I know that I was going to create my own? No, but I knew I wanted to take that chance. And then in business school, had the opportunity to try and create a company that did not end up taking off, but it taught me a lot that I was able to utilize in building CareWear. And I mean, this is now doing my life's mission, and I think everyone on our team has a personal story for why they're here, which I think is really, really cool. And we're just at the beginning, so we're really excited about the impact that we'll be able to make, and really the ability to transform healthcare over the next hundreds of years.
Yeah. So, so what do you think is the most critical skill that an entrepreneur should have? And if you had any advice to future entrepreneurs who want to start their own company, since you've done this?
Yeah, there's a lot of skills you should have. Now, I think the most important thing is the passion and ambition to not give up. I think one of my investors said it well. He was like, I know no matter what problem or issue comes up, you're not going to take it as a loss. You're going to figure out a way around it. And I think my perspective is this population that we're serving never gives up, right? Like the
Yeah.
patients that we serve could be going through really bad cases, but they are people that are fighting till the end. And
Yeah.
on that same side, the clinicians that are servicing them might be having a bad day or might have family issues, whatever, but they still go to the hospital. They still help people recover and try and get better. And I think that for us, it's if we're serving this population, then we really can't give up. And so it's using that inspiration to try and make a difference each and every day.
Yeah. And what advice would you have? Like any specific advice? Like I would say in your case, if you're to like go behind like these large institutions, probably you had to like have zero ego. Because the number of no's you've probably heard is
Yeah, I mean, thankfully, I've been rejected a lot in life, so I've had a lot of practice from day one. I'd say the biggest thing is don't be afraid to ask, right? Like, I think so many founders and entrepreneurs are scared of asking for help or asking for favors or whatever. And I think I've learned you aren't going to get a yes if you don't bother to ask. And so it's trying to do whatever you can to trying to put people in a position to help you or to move forward with using you or your products or whatever. And I think that all comes down to asking people for help.
yeah. Thank you, Chaitanya. It was great talking to you, and I
Yeah,
have
great
to
to
say,
speak with you as well.
yeah, very inspired by your mission. It's amazing. I would say that this is great work, an area which not a lot of people think about, but it's so important that you need to look your best even in a hospital to make
Yeah.
yourself feel better. So I really enjoyed, and this was great.
Thank you so much for having me, and excited to be here. And hopefully, this is just the beginning for all of us. So thank
Yes,
you again.
yes. This is definitely the beginning for me.
Yeah,
All
you're
right.
going to do great.
Yeah. All right. I'm going to end the recording.